Now we're going to talk about some of the problems with the spine that would lead you to have surgery. If you're watching this video, I'm sure you've already had an appointment with your surgeon, your difficulties have been determined and a plan has been made. But I always like to go over the problems with the spine that would lead you to come here to St. Joseph Hospital. The first one is probably the simplest of them all, which is a disc herniation, also known as a disc bulge, a slipped disc, a disc protrusion. And that happens when one of the discs between vertebrae gets compressed and just simply comes out the side. When that happens, very often a nerve will be impinged or the disc will actually push on and touch a nerve, and that's where all that pain that you have comes from. Usually with a discectomy, as we would call it, it's a fairly simple surgery. Sometimes it's even outpatient, and people recover from those fairly quickly and don't have any need to stay in the hospital overnight. Now, moving on, we can have something also called spinal stenosis, and all of these problems do not have to be independent of one another. But spinal stenosis is when not only might you have some disc herniation going on, but there be bone spurs or bony overgrowth that narrows the canal, not only maybe around your spinal cord, but also the nerves that run off your spinal cord. And that's where people tend to have more problems, and those are the folks starting there that we see stay in the hospital after surgery. In order to clear that up, there's a little more work that your surgeon has to do. You may develop leg numbness, or if it's in your cervical spine, arm numbness with this sort of thing, mobility issues. And whereas a herniated disc usually is something that's a short-term problem and taken care of fairly quickly, spinal stenosis is something that develops over time, and you may have lived with something like this for quite some time. Another issue that can go along with the prior two is instability of your spine. And that is when one vertebrae is sitting on top of the other, either forward and back, side to side, or all three ways, is just not stable. And not only could there be stenosis and disc issues, but the bones are rubbing on and around each other, and that's a very unstable spine. And so when you get to that point, that's when a spinal fusion is necessary to not only help with pain, but also with your spinal cord and all those nerves to keep them safe. As I mentioned before, discectomy is very simple. Your surgeon just cuts away that disc material, gets rid of it, makes sure everything's free and clear. It's usually a very small incision and a fairly quick recovery time. It does improve that acute pain that you may have running down your leg or your hip, and usually recovery time is a few weeks. When we talk about a fusion of the spine, the recovery time for that is a bit longer. Your surgeon will be going in and cleaning up the disc material, cleaning up any bone spurs, any bony overgrowth to make sure your spinal cord is free and clear, the nerves running off of your spinal cord are free and clear. And then because sometimes the disc is worn down and bone is worn down, they will actually position those two vertebrae the correct distance from each other, and they have different types of instrumentation that will hold those two vertebrae in the correct position as you heal. The idea later on is that your own bone is going to grow around that instrumentation and seal the deal, if you will, on that fusion. But the instrumentation is there to keep everything right during that process. Sometimes a surgeon will use donor bone that is from cadaver or a bone donor. It's sterile and put through a lot of testing, so no worries with that. A material they use very frequently for plates and screws and instrumentation is titanium, and that doesn't usually set off the machines and everything at the airport. Years ago, people used to have to carry cards around with them, as they go fly and travel. But this instrumentation is not supposed to cause any problems at the airport. Benefits of having spinal fusion surgery, of course, is decompressing the spinal cord, decompressing those nerves, helping alleviate pain, whether it be a hip, leg, arm, depending upon where your problem is, weakness, numbness, and to stabilize those vertebrae. Something very important to point out is that nerves do heal, but they're one of the slowest healing tissues in our body. So after your fusion surgery, don't be disappointed if you don't have immediate relief. It's just going to take a little bit longer than, say, incision on your skin or something like that. Another thing to point out with spinal fusion is that there's a lot of work in a very small space that they do, and every great once in a while they may nick what's called your dura, where your spine is, and some spinal fluid can leak out from that. Your surgeon will fix that immediately during surgery, but in order to make sure that holds, they may have you lay flat overnight, and just overnight. Is this dangerous? It's not dangerous, but it will cause the mother of all headaches, and we don't want you going through that. So they will repair this immediately if it does happen. We'll have you lay flat overnight to make sure that that all seals up, and then we'll get you up and proceed with therapy and mobility the next day. Briefly, I do want to talk about cervical spine surgery, which would be in your neck. Most of our patients that stay overnight, their surgeries are going to be in the lower part of their back, but we do have some patients that have it in their cervical spine as well. Usually these surgeries are fairly simple. Some of these people go home the same day. Some of them stay overnight. It kind of depends on how much work your surgeon has to do. But in the same fashion as in the lower back, smaller instrumentation is used, but they always, even if they're doing a discectomy, they're always going to fuse up in that cervical spine just because your spinal cord is definitely there. Your spinal cord stops before your lower back, where a lot of our lumbar surgeries are done, but certainly not in the cervical area. So very teeny tiny instrumentation will be used to fuse that if in fact you're having cervical spine surgery.